Pressure volume and flow volume loops. A loop is an inspiratory and expiratory curve connected together. Allows you to quickly determine a patient's dynamic compliance by looking at the slope or pitch. Can determine if a bronchodilator treatment has been beneficial. Can be obtained from both numeric values and from the shape of waveforms. But is not an expression of time. Pressure volume loops. In general terms, these loops are looking at compliance. Pressure volume loops also indicate hyperinflation. Prolonged inspiration leaks normal values for dynamic compliance. For a ventilator patient is 50 to 80. The middle line or axis is showing the patient's dynamic compliance. Total lung compliance can be described as a change in volume in relation to the changes in pressure. When an obstructive or restrictive pulmonary disorder is present, this curve will increase or decrease, and as a result ventilatory efficiency is decreased. Increase or lung compliance patients with COPD have wide pressure volume loops with a left shift of increased compliance. This is caused by increased airway resistance. Increased compliance is often a gradual change. Decrease lung compliance. A decrease in compliance causes a right shift in the loop because more pressure is needed to deliver the volume. Decreases can occur gradually through a disease progression, like a RDS, or suddenly with a mucus plug present. FRC is the volume of air left in the lungs at the end of a maximal exhalation. This is an important factor when looking at pressure volume loops because when the FRC is reduced, and it occurs with reduced compliance, as well as increased airway resistance, then work of breathing is increased substantially. The work of breathing is essentially the amount of pressure needed to move a particular volume through the lungs for each breath. Can occur when the lung is damaged by the action of the ventilator. Occurs when there are high inspiratory pressures. Occurs when the volume capacity of the lung has exceeded its limit. Often associated with injuries in RDS patients, such as barrel trauma. Increased resistance on inspiration may indicate tube too small or kinked. Patient biting tube. Increased resistance on expiration may indicate a bronchospasm. A bronchodilator treatment can be delivered to decrease resistance. Secretions will appear on a waveform as less being exhaled than was inhaled. Leaks that occur on the patient's side will appear as part of the inspiratory side. Sources for leaks: endotracheal tube cuff leaks, bronchopleural fistula. Air leaks through the chest. Equally diminished volumes can indicate a leak in the vent circuit between the flow transducer and the vent itself. Similar to the flow volume loops reported in a PFT study, but differ because mechanical breaths do not represent a maximum spontaneous effort. The shape of the inspiratory curve reflects the flow pattern set on the ventilator. The highest point represents the PEFR during passive exhalation. The shape of the expiratory curve is influenced by airway obstructions. The dotted line represents a normal expiratory flow rate for comparison. Most types of significant airway obstruction will reduce PEFR.